Welcome to Season 2 of Beneficial Conversations, your insider's guide to the evolving world of employee benefits. This season, we're going deeper into the strategies, stories, and solutions that are redefining how organizations support their people. From cutting-edge benefit innovations to the real-world challenges keeping HR leaders and CFOs up at night, we bring you honest conversations with the experts who are shaping the future of workplace well-being. Whether you're designing benefits programs, advising clients, or simply want to understand what's next in the world of work, you're in the right place. Let's dive in. Welcome to Beneficial Conversations. I am your host, CJ Jordan, and today I have the pleasure of being joined by Dr. Juliet Breeze with Next Level Medical. Dr. Breeze, thank you so much for taking some time today. How are things going?
Things are great. Thank you very much for letting me come and chat with you today. As you know, I love this topic, so I'm excited to talk to you.
Good. Well, the first question that I ask all of my guests is, I need to hear about your favorite or most memorable meal that you have had. I know you travel around, so it can be, something that you've had in a different city, country, whatever. It can be something that you've done at home, and this can go in a variety of ways, but I want to hear about your best, most memorable meal that you've had.
So, you started me off with like the hardest question you can ask a foodie because I love to eat and I love trying new restaurants and all
Yes.
that. But if somebody recently, asked me what my my deathbed meal would be, or whatever that is, I guess, when you're in jail and you get your last meal.
The last meal.
Yeah, right. Yeah. So I have to say, I'm a runner, and I can put away some food. And
Yes.
I used to live in Chicago a while back, and
Okay.
the Chicago deep dish pizza is literally to die for. And I used to be able to polish off a whole one by myself. And I
Whoa.
absolutely, yeah, that would be it. And
Okay.
I've been all over the world and I've eaten some fabulous things, but there's nothing quite like just a delicious deep dish pizza.
Now, the follow-up to this, because I love Chicago. I have a lot of family in Chicago. Where are you going in Chicago? Are you a Lou Malnati's? Are you a Giordano's? Are you a Pequod's? Like, come on,
Okay, so
we got to dig down a little bit.
in college, I worked at Giordano's. I was like the hostess at Giordano's, but actually, Lou Malnati's is my place. So
That's when my wife and I have gone up there. Whenever my in-laws are actually going up there in a few weeks, and I was like, there's some different places that you can go, but my recommendation is Lou Malnati's. So
it's
we are
amazing. Yeah.
kindred spirits as far as that goes. I haven't polished off a full one, but
well, when you run 26 miles, you can do it. Yeah.
Yes, I did. I think after a half marathon that I did in New Orleans, it wasn't a pizza, but we went to a burger place called Yo Mama's in New Orleans, right off of Bourbon.
Love
and
it.
I mean, easily double cheeseburger with bacon, fries. And it was like, that was easy that was just a half. But after burning that many calories running, it's like, all right.
Well, and by the way, as a physician, I just want to go on record saying that nothing that I just said is good for you. So do not do it. But yeah, it's still delicious.
Oh, love it. Love it. Well, I want to hear, I want to get into a little bit about you and your background. So kind of take me through your history and how you got to where you are right now. And then we'll kind of take it from there.
Oh gosh. Okay. Well, I mean, sort of long story short,
Sure.
I was raised by an entrepreneur and a teacher. And when I decided to go into medicine, I thought that I was really excited about being able to be in a caring profession. I thought what could be better in life than being able to do something where you earn money for, doing something that makes you feel good about about your contribution. But when I actually got into healthcare and I actually became a doctor and started to see what our healthcare system really was, I was really disillusioned. I felt
Sure.
I saw a lot of problems. And even from my very first job, which I got fired from for revolting. But
Okay.
I was, I worked for a hospital and I just felt that the care that they were giving was subpar. And
Sure.
I was unwilling to send my patients to the hospital from which I got a paycheck. So they
Okay.
parted ways with me.
Sure. Yeah.
So I felt like, there were some early things that were pulling me to try to be on the reform side, and then when I got further down the line, I had the opportunity to start working in a variety of different healthcare settings. And I just saw the same issues coming up. You know, there were patient safety issues, there was efficiency issues, there's confusion, the payment system is crazy. There's
Yep.
just, you can sink your teeth into healthcare and try to problem solve for a really long time without getting, to the heart of some of these issues. But anyway, so I've always been who I am today, which is like a person who really believes that
Right.
there's a better way and that we need to move toward that. So, more specifically, when I got to the part of my career where I started Next Level, Next Level was actually a response to a problem I saw in my community. There was a proliferation of um, freestanding emergency rooms, which means not attached to a hospital, but just in
Right.
a strip center or what have
Yep.
you. And in Texas, where I was living and I'm still living part time, I they were on every street corner, literally in
Yep.
Houston. And so myself and my friends and family ended up in those places when we couldn't get care from our regular doctors during
Yep.
regular business hours, and the bills were astronomical. And I knew, because I had spent my career in healthcare and I had been doing a variety of different things, I knew that I had the skill set to create a more cost efficient after hours and late night healthcare setting. So that's what we
Yeah.
did. We created Next Level. We launched 9 clinics in 10 months, and we were off to the races. And that was the end. So initially, it was urgent care. It was care that wasn't, for heart attacks and strokes,
Right.
but pretty much we could do everything else, from broken bones to lacerations to common colds. And we did it all 12 hours a day from 9 a.m. to 9 p.m., 7 days a week. And that was, it has been a wonderful business. But honestly, as time went on, I saw another problem happening in healthcare that I felt we could solve with what we'd already started building.
Yeah.
So the problem was that more and more people were finding it very hard to see a primary care doctor. They were, either they were costed out of being,
Yeah.
able to go, or they just didn't have the access. Like their doctor had a 3-week wait period for
At a
getting in to see
minimum,
them or
3 week
something like
wait
that.
period, it seems.
And here I was with all of these centers that were open 7 days a week. We had capacity, and I started to try to think about how I could use what I had to solve
Yeah.
that bigger problem. So that's sort of like the history, the evolution.
So when you started the 9 centers in 10 months, were you like, because with your background and being able to practice and stuff like that, were you actually in and still seeing patients, or were you, and this is more just me out of curiosity,
Yeah.
were you in seeing the patients some,
Well,
or were you managing from kind of the high level as far as organizational and all that?
I always try to tell people that I'm a recovering physician, but I actually did practice a bit when we
Yeah.
started, and that was mostly because um, it was hard. It was actually, I thought that I had the best idea, right? Okay, so there's these ERs, they're charging thousands of dollars for very simple things. We're going to
Yep.
put up a center that it's only, like $150 for the same thing that you'd be paying several
Yep.
$1,000s for. What could go wrong here? But actually, what happened was that people didn't understand that. They, saw us the same way they saw all of these clinics. We didn't look particularly different. They didn't understand the difference between urgent care and ER. Now it's a little easier, but back 14 years ago, no one really understood that distinction. And so
Hmm.
we were slow, and we had to go out and get business, in order to survive. And one of the things that I ended up doing was I happened at the time to be the only one who could pass this crazy test they have in Texas that allows doctors to have this designation. They're called a designated doctor. So you could see more advanced work injury patients. And so I
Hmm.
got that designation and I started seeing patients to draw employers. And this is like, I guess, how the
Yeah.
world works, right? So I was simply trying to survive. But in the process of simply trying to survive, we started building really strong relationships with area employers because we were very good at taking care of work injuries. Part
Yeah.
of that was that before I opened Next Level, I had run an orthopedic office for 9.5 years. And so we used what we knew from that and we became very good at injury care.
Yeah.
So that really helped us when we started to realize that employers were a key to, what we wanted to unlock next.
Yeah, so that, I mean, that was going to kind of be my next question. I mean, it sounds like it almost started out as like you could call it like a straight to consumer,
Yeah.
just for the random people that might be walking in. So as you started to take on those work injuries, was that kind of a light bulb moment, or maybe a shift, or it was like, hey, maybe it makes sense to try to partner with, specific businesses in this
Well,
model?
kind of. I mean, to be honest with you, the light bulb moment was when I realized I put on my other hat, which is I'm an employer.
Uh-huh.
And at the time, I had 440 people on my health plan,
Wow.
and my costs were really high. And as a line item on my P&L, my benefits were one of the highest items. And I thought, here I am, a provider of healthcare, and my people are costing so much money to take care of, to keep them in health benefits. Not only that, but I did like an employee satisfaction survey. And one of the comments that came up more than once was, we don't think we have very good benefits. And I
Mm.
was like, wait, what? I'm paying millions of dollars and they don't even think they have good benefits. What is going wrong here? And how can I address this? So I
Yeah.
thought, this is crazy. We do healthcare. I was my first employer that I
Sure. Yeah.
created the program for. So the program was basically taking what we had built and providing it free to our employees. Because when I dug in on why they didn't think they had good benefits, one of the major reasons was that their deductible and their copays were so high that
Yeah.
they felt like they couldn't really use the healthcare anyway. And
Yeah.
so we decided we're going to do a $0 option, and you still have insurance, you still
Yep.
have the ability to get things taken care of and do whatever you want. But if you want, you also have this free option, and it's everything we cover. And of course, by that time, we had gone through COVID and we had
Yep.
added to our services. So we had virtual care, we had asynchronous care like chat, and that we
Hmm.
had lab, we had mental health, and we had health coaching, and we had care navigation. So I felt like we had put together a suite of services. The care navigation actually came out of me wanting to make sure that when our employees were using us, that we were taking care to send them, if they needed specialist care, they needed
Yeah.
something beyond what we could do, that we were taking control of that and making sure that they weren't going to the most expensive place, because we were self-funded and we were paying every dollar of that anyway. So I'm not sure if this story's been on the internet, but that first year we saved $500,000 on our own healthcare, and that was really that light bulb moment where I was
Yeah.
like, you know what? As an employer, I really appreciate this program. And I think that other employers are going to appreciate this too. And so 5 years fast forward, they really do. And it's been a fantastic, it's actually incredible. This year has been by far the most fun because we have so many customers that are telling other customers that
Yeah.
it's lightened up our load of having to explain it and sell it, and that kind of stuff.
I mean, selling, saving $500,000 on your plan while also making the plan better seems just like incongruous to most
It's
people,
like
or like
nirvana.
that's
Yeah.
not possible. But I mean, talk about like where, I know just from what I do, but talk about like how that saving, where did the savings happen? How did you generate the 500,000
Yeah,
based on the services that you offer? Just for those that might listening, like, well, how did you
totally.
generate the
How do we
500,000?
do that? So here's the crazy part. Okay, so you know, I run an urgent care, and my employees, of course, know that they work in an urgent care, but their dependents didn't always connect the dots. So
Yep.
we still had very high freestanding and regular ER usage, because, again, people were, and also, by the way, I mean, if you're of a certain age, you grew up where when you got hurt at night or on the weekend, you went to the ER. And so,
Yep.
like, that's just a thing that people are used to doing. That's a hard habit to break, but it's a lot easier to break when you know that it doesn't cost you anything if you go here, but
Yep.
if you go to this ER over here, it is going to cost more. And we did definitely increase the co-pays for ER
Yeah.
use when we
Carrot and
did
stick.
this. So we had that contrast, and people could make their decision. They still could go, but they
Yep.
were going to have to come out of their own pocket a little bit for that too. And we found that we could take care of a lot of things that had been going to the ER, ourselves. The other thing, to be honest, was that we were, the care navigation really does work. We had a specific program that we used where if they went to a certain radiology group that had very fantastic discounts for us, then they didn't have to pay anything for
Yep.
those. But if they went, they could go anywhere else, and they were welcome to do that. And they just had a co-insurance like they normally did.
Yep.
And so we were able, with between referring to specialists that weren't crazy expensive, referring to hospitals that weren't crazy expensive, and we know which ones those are.
Yep.
And so that was where the savings went. Also, by the way, people don't realize this, but labs are, especially in the hospital setting or a hospital outpatient department setting, they're marked up like 60 to 100 times the cost. So we were just
Crazy.
doing labs at cost, and
Yeah.
I mean, it was a huge savings. So yeah,
I mean, I feel like when you give people the opportunity to decide, I think that's important instead of
I
being
do too.
forced, like, oh, well,
Yes.
don't tell me where I have to go. But if you lay things out and say, you have the option, you can go this route. And, we
Yep.
know and we believe that it's high quality because we've vetted it and we know them. And if you go this route, you're going to get good care. And oh, by the way, it's going to be $0.
Yeah.
But if you just are adamant about going to this person because you know them, you went to high school, like whatever it is,
Yeah.
like sure, you can go do that, but just know that in doing so, you're going to come out of pocket. And I think people are willing to shop they're willing to shop for services when they have the ability. And when you give them the option and say, this route is good and free, this
Hmm.
route maybe, and you're going to pay for it, like more often than not always, but more often than not, they're going to make the right decision.
Well, CJ, you said something really important that I think, any employer who's watching this, needs to take note of, which is when you tell an employee, oh, here's your benefits, and by the way, it's a narrow network and you can only go to this thing. They hate it. They hate it right off the bat. It doesn't matter, because you're telling them what to do. I tell people when they put next level, our own membership is called Next Level Prime. If they put Next Level Prime in place, the biggest mistake they can make is telling employees that they have to use it.
Mm-hmm.
Just tell them, hey, this is a free benefit that I'm paying 100% on your behalf for you and your family. And if you ever need, a virtual visit or urgent care, because you stepped off a curb and twisted your ankle, or maybe you want to use them for your primary care because they can take care of you on a Saturday or a Sunday or a Thursday evening, but you don't have to. This is just an option for you. I will tell you that we see, because now we have employers that have stayed with us for 3 or 4 years, and we see employees making that decision over time. So the first year, they're not going to switch their primary care, but they might use us for mental health or urgent care, and they'll
Yep.
realize, wow, that was really easy. I
Mm-hmm.
got in quick. That was a good experience. And then they start thinking, well, I could use them for, this and that. And all of a
Yep.
sudden we have their business and we didn't force them at all. And I think that that is why our net promoter score stays so high. We have a way above industry net promoter score for our patients, but it's also why employers stay with us, and that's a big one. We don't have any turnover of our employers. We don't lose them once they come in,
Right.
because their employees are so happy with the benefit. It's very difficult benefit to take away,
Yeah.
because employees feel like this is something that you really gave them. Yeah.
Yeah.
Unlike some other things, which is like, here, I gave you this, but in order to use it, you have to come out of pocket, $400 every time you see someone.
Right. And I want to make sure we kind of get specific on this, because I think we've talked, you've maybe referenced it, but as far as what y'all are offering, let's get specific as
Yes.
far as, hey, we put this program in place with an employer group. What are employees able to receive? What are they able to get when they go visit? Like how,
Yes.
why, when would they use y'all's services?
So employees are sent a link the day they get their membership, and the link
Yep.
links them to our app. In the app, they can literally press a button, I need care now, and it will guide them to the most appropriate options that are available for them. So if
Mhm.
they just have, if let's say I'm a mom, I'm sitting at home with 3 kids, and one of them looks like they have pink eye. That's like a nightmare scenario for most moms, because you have to drag all the kids with you to the doctor, and it's pink eye, and all you need is the medicine so that the
Yep.
other 2 or 3 don't
Give me
get
the
it.
drops and let's go.
Yeah, exactly. So in the app, if the mom puts, yeah, I think my kid has pink eye, then the app is going to say, do you want to skip a visit and just get the medicine? If so, here are some questions you need to answer. So they answer questions that will rule out more serious things that it
Sure.
could potentially be. And if at the end of that algorithmic care,
Sure.
we agree that they have pink eye, then their medicine just gets sent in and the mom can
Yep.
go pick it up. So that is the kind of sort of care that they get. In that app, they have opportunity to set up their annual physicals, to get seen for in person or virtually. And the virtual can be a scheduled visit or it can be on demand.
Okay.
When they access that care, we have a huge panel of labs. Most labs that are common are included in the membership. The most important thing to me was that people weren't told, I gave you a free benefit, but then when they show up at the clinic, they're nickel and dimed for every little
Yep.
thing. So we include immunizations, we include durable medical equipment, we include all the things that you might get at an appointment
Yeah.
are thrown into the membership, so that you don't have employees feeling like they got a bait and switch.
Yeah.
So, there are some things that aren't included. We don't do, surgeries. We don't do hospitalizations. We don't
Of
have
course.
specialists right now.
Right.
And we don't have, in our membership, we don't have pharmacy. That, we'll talk a little later, but, we're expanding this now to include others in this format, and they have the opportunity to put whatever they want in their membership. So I was talking strictly about Next Level Prime right
Yeah.
now and what we include. But, like I said, a patient can get health coaching, they can get care navigation. And the other thing that's available on the app is an elective GLP-1 weight loss program. So
Nice.
if a person wants to, they can pay themselves for that. And that's been very popular with some employers that were getting, you know, getting some huge bills for GLP-1s. And
Yep.
now their employees are given the opportunity to pay for that themselves, but it's at a very discounted price. And so employers feel less bad about taking away GLP-1s for obesity.
Sure.
Most are still doing it, obviously, for diabetes, but
Right.
for people who just are asking their doctor to please, please, please say they have diabetes so they can get the GLP-1, they don't have to do that anymore because they can
Right.
afford to do it through the program.
And so, I'm okay with not having the specialist as part of it, because, there's an element of, I think it's something like 55% of Americans don't have, a primary care
Right.
doctor.
That's right.
I think that number's somewhere close to accurate. And
Yeah.
so, you know, having a place where they can go and still be referred out, like
Yeah.
we want this to essentially be the quarterback for the rest of your health program. And
Mhm.
you, with y'all's background and networks and connections and understanding of quality and all that kind of stuff, have the ability to say, okay, we noticed that you're having some gastro issues, or whatever it might be. We're going to refer you this way. And again, you're not having to solve every problem, but you can direct people to get the appropriate care.
Well, it goes back to what we were talking about earlier, where I didn't want to be prescriptive in that manner, because so many employers have opinions about what they want for a plan in the back end. So I still think that people should have insurance of some sort. Some employers want to do reference-based pricing. Some employers want to be part of a TPA. Some employers want to go with a BUCA. Whatever they want to do, they can do with us as the front end. So we're just navigating to whatever they've chosen on the back end. Some employers have point solutions that they like, Surgery Plus, that they want us to use for their patients. So we've developed technology that serves up that those choices, those selections that each individual employer has made. So when our care navigators are talking to that patient, they know, oh, this person is at this employer who only uses this hospital network, right? And so that's kind of what we developed. And again, it was sort of to be Switzerland and not
Yeah.
lock us out of being a solution for somebody who had a real strong feeling about what they wanted on the other side.
What do you think is the biggest, I guess, misconception, around, and maybe we just kind of touched on it, but what do you think is the biggest misconception around advanced, direct primary care, as far as what it is, what it isn't? Like, do you think that employers or employees maybe get some things wrong about it?
Well, I think a lot of people throw around advanced primary care. Um, we look at it, the reason that you throw in advanced is that it's more holistic,
Hmm.
more team based. You should include mental health. And I think a lot of times, what I tell people that we're doing is sort of, advanced primary care on steroids, because not
Yeah.
only do we do all of the things that would be included in the most broad definition of advanced primary care, but we also include things that are done in urgent care. So one of the differences between us and direct primary care, so there's primary care doctors that are out there and they hang a
Right.
shingle and say, I'm a direct primary care doctor. I only go direct and I don't take insurance. And we're different from that because those people will still end up having to send to the ER if a person breaks a bone or if a person
Yeah.
has a laceration or needs IV fluids. They generally don't do those in their office. And that's a generalization, but most of them don't.
Sure.
Whereas we're taking care of more things. And that is why we can generate a lot more savings than the traditional model, because
Yeah.
we're doing, in the first year that you're on this program as an employer, the place you're going to save the most is ER diversion. That is just what it is, because
Yeah.
I don't care how great of a direct primary care doctor you are. It takes time to get people's diabetes under control. It takes time to get people to, be eating right and doing the right things for their hypertension, their hypercholesterolemia. So that first year, you're not going to really just like change the tide completely on your
Right.
chronically ill people. And so, but I believe strongly that if people are getting regular primary care, then in 2 or 3 years, those people who would have been in the hospital for their first event, their first heart attack, their first, kidney failure, whatever, that is what you are affecting when you put that stuff in place. So direct primary care can do that. What we do that, but we have the added benefit of having that initial impact on the ER.
So yeah, y'all are able to deal with kind of those significant acute issues
Yeah.
while also working with patients or
On long-term health
employees on
preventive.
the
Yeah,
chronic conditions.
exactly.
Because I mean, I think that's such an important piece, and it's really difficult to measure, right? Like the
Yes.
chronic piece. If you're able to see those people on an annual basis, and you're able to get them to come in for their annual wellness screenings, and you're able to catch something early on,
Early. Yeah.
it's really difficult to measure the financial impact of that down the line because you're able to address it earlier
Well,
on in the care journey.
and I'll tell you another thing that makes it hard is that people these days don't stay at jobs for very long. So a
Right.
lot of employers are like, well, I don't want to spend a lot of money on a person who I know isn't going to be here in 4 or 5 years. But my feeling about that is actually, let's just say that you're not going to feel any of the benefit of this. What you will feel is that because you chose something that is open after your work hours and on the weekends, you have people who are not missing work to get their chronic illnesses treated. So if you have a diabetic, that person is going to have to take time off of work if they're at a regular doctor for their diabetes, because
Mhm.
most doctors are open 8 to 5 Monday through Friday, which is when work is in session. So that's what makes it really hard. Is I feel bad. People with chronic illnesses really have it tough. First of all, they have got copays that are just can be crushing if you have to keep going back to the doctor. And in a fee for service world, the doctor makes them come in because that's how they get paid. So in our system, we don't have to have that diabetic come into the office we were already paid. So if they want to chat with us or do a virtual or just do a screener, that is all healthcare that can be performed for them and can keep them healthier without forcing them to like make other concessions in their life, like having to take PTO or something like that.
I mean, it's an alarming trend that's
Hmm.
happening right now with the increase in deductibles for groups, or with the increasing of out-of-pocket max, or even copays to an extent to shift some of these costs or drive down premiums and stuff. All that's happening is that barriers are being put into place for people to be able to access the care that they need. And I can't remember. I mean, there's a recent statistic that came out that's an alarming number of people are putting off the care that they need because of the cost to get it.
Totally.
And when you can remove the barriers to care for people by making it, a free option,
Yeah,
um, sure, they may not be at your company, in 5 years, but I mean, I would like them for them to still be on the earth in 5 years.
that's
And
right.
it's just like, I know that's easy for me to say because I'm not writing the check for all this stuff, but at some point we do have to put the people for however long they're going to be at the company. I'm not just saying like write a blank check for
Yeah,
everybody's medical costs or anything like that, but we've got to put things in place that remove barriers to care, because I mean, you just talked about it. Like there's even soft costs that are going to benefit when you have a healthier workforce, that there's going to be less absenteeism, and there's also going to be happier. And there's
yep,
statistics out there about when you have a happier workforce, they're a more productive
more
workforce.
productive.
So I mean, there's so many downstream costs to removing the barriers to care. And I just like, God, we've got to get healthier. And like in some cases it has to be a grassroots effort at the employer level.
That's right. Well, I'll tell you, I'll make you feel a little bit better about employers. So, one of the things that I did early on is I put in place a question that every patient has to answer when they are using their membership, and the question is, if you didn't have this membership, where would you have gone today? And so the multiple choice is like, I would have gone to the ER, I would have gone to another urgent care, I would have gone to my primary care doctor, or I would have gone nowhere. And I put the question in place because I wanted to quantify how many people said they would have
Right.
gone to the ER.
Yeah.
The more striking answer was that still about 33% of our appointments say they would have gone nowhere. And when I show that to employers, that it makes them really happy because they feel like they actually did pay for something that someone valued, right? So like, I think that it's very hard as an employer that time when I got the surveys back that they said they didn't think they had good benefits, and I had just cut checks for millions of dollars, and I was like, what? But if at the same time, if they would have said, I think I have the best benefits in the world, that would have been money well spent, right?
Yeah.
And so when somebody sees that their employees, 30% of them would have come to work sick, stayed home and not gotten care, they wouldn't have gone in because they couldn't afford it, or they just didn't have the time. I mean, whatever the reason, and now they can do it. I think that makes people feel good. So.
Yeah, agreed. And so this program, obviously, it's available for full-time employees, but I think it's even something that I guess y'all can extend to part-time, or
We don't
employers can
care.
extend to part-time. Okay.
So an employer can put anybody that they want to pay for on the list, and
Yeah,
we're not insurance. They are
sure.
directly paying for services from us. So here's our suite of services that you are paying for. The payment is a per employee per month. That includes their dependents, and however many people are on this list, that's on you. So if you want to put your part-time people, or you want to put people who aren't even on the health plan, that it doesn't matter. What we do ask is, at a minimum, you put the people who are on the health plan, because we price it for a population. We don't price it for an individual.
Yeah. Okay. Okay. And so, when you're putting, and I don't know how often you are, but when you're sitting in front of CFOs or something, and maybe this is the first time that they're
Often.
hearing about it, or maybe that they've been steered in a different direction as far as, going the traditional route, like what conversation are you having with the CFOs to help them understand maybe that disconnect that might be happening as far as conflicting advice or something along those lines?
Yeah, I mean, CFOs have a really hard job, and they really can see all the money that's being spent, and so they are very careful. And they've also probably all had the experience of paying for something that didn't work the way that they expected. So my conversations with CFOs are very different now than they used to be. In the past, it was, hey, I did this for myself. These are my numbers. I was the only case study I had. Now I have, hundreds of case studies. We have 634 different companies using our membership. And so, we have a lot of references. And
Yeah.
what we've done recently is gotten a bunch of CFOs that really love our program together. And they taped some comments about how they feel about the plan. And that's very impactful, because hearing it from me, I'm a vendor at this point, even
Right.
though I am an employer, but hearing it from another CFO who just saved $3 million on their health plan. And these are big numbers. We're not talking about small numbers. We have one client who has saved $13 million in a year, because they have a huge number of employees, and those employees were using healthcare in very inefficient, costly ways, and so
Yeah.
we were able to bend that for them, and so it's very gratifying to be able to show those case studies and those numbers, and show those, connect them by phone with other CFOs.
Yeah, because I feel like the initial question that if I'm putting on my CFO hat, my first question is, well, what's this going to cost? So, well, this
Yeah.
is just an added cost onto the plan.
Mhm.
But I mean, it sounds like you're able to turn around and say, yes,
Yeah,
we acknowledge that there is an additional cost, but here's your ROI. Like this
exactly.
is what you can typically expect from a saving standpoint. Like you're not just
Yes.
spending money, you're getting some back.
Totally. And what's kind of cool, what we do have a performance guarantee. So we for every client, we guarantee that they will not spend more on the membership than they would have spent on the same services in a fee for service environment. So what we do is, let's say I have 10 employees and they use, 100 primary care appointments, and 100 urgent care appointments, and 20 mental health, and, this and that. We put a fee for service value on all of that, and then we compare it what they spent on the membership. And
Yep.
we've never had it be that they have spent more on the membership, but if
Right.
it ever happened, we would refund the difference. So,
Sure.
so I think that allays some fear that they're going
Right.
to spend more than they save. But then the other thing is that we now have some really good data about how much savings they'll get in that first year by ER diversion. We just got a client on Friday who I've been talking to these people for, gosh, about 4 or 5 years, and they finally decided to pull the trigger and do it. And I asked, what finally made you change your mind? And they said, the ER spend is out of control. We just
Yeah.
don't know what to do. So we believe that this is going to help, and I think they're going to be really happy.
Yeah. So, obviously that speaks to the CFO side, but there's another side of the house as far as HR and the hats that they wear and the questions that they get might be a little bit different. So,
Yeah.
what message are you communicating to the HR who maybe has a little bit more finger on the pulse as far as employee,
Happiness.
frustration
Yeah.
or
Mhm. Yeah.
happiness, all that kind of stuff? Like, what are you communicating to HR when you're sitting with them?
Well, that's the thing about, so the HR professionals understand, that the messaging is so important. So the
Yeah.
messaging of this is not a narrow network. This is an opportunity for us to thank you for being wonderful employees, and we're giving you a free service that you can use for you and your family. They really appreciate the 7 day a week opportunity, because they have to deal with PTO, they have to deal with all of the fallout of people coming to work sick or people having to leave work in the middle of the day, and so that is very significant for them, that impact of being able to have such wide coverage. The other thing is the navigation. They want to make
Yep.
sure that they've selected benefit plans. They want to make sure that their people are using them. And that's, I think, another thing is that they always ask, well, what's the utilization right now? Our utilization across the board and pretty much stands for most employers is about 68% of their
Wow.
people will use the service in the year. And that is very high utilization for any healthcare benefit. But I will say that that can be up to 100% if you have great messaging and you have incentives for annual physicals, because there's really no obstacle to getting an annual physical when you can do it on Sunday or
Yeah.
or like, I mean,
Yeah.
really, what are you going to say? It's free and you can do it
Yeah.
anytime. And so, employers that put in those incentives will actually get, 100% utilization, and that those annual physicals help to find early problems that we can cut off at the past. We've found so many early cancers. We've gotten so many people who didn't know they had diabetes, who didn't know they had, they were going into kidney failure, those kind of things. We have a lot of really great stories of saves that, are definitely that, it's, it's money. It's a person's life, and it's also money.
Yeah. And so you've said, I mean, and it's even a part of your first job. You said, you are a huge proponent of the value-based care model as opposed to fee for service. But I think you even said you feel like that's the direction. The value-based care is the direction that you think things are going to trend towards in the future. Speak on that a little bit. I mean, is that a hope? Is that something that you really want? Like, I
Yeah.
hope it's the case, but
Yeah. I
I'm
mean,
just kind of curious your thoughts on that.
so I think it's more that the current trajectory of the way that we're paying for healthcare is completely unsustainable, and everyone knows it.
Agreed.
So, like, to say, oh, it's going to stay the same that's not going to happen. So it's going to be something. What I think is that people are starting to get very creative. I think there's going to be tons of innovation, way more than there used to be. I mean, everyone talks about you can't have a conversation without talking about AI, but there's a lot of opportunity that comes with the technological advances that we've kind of all been watching over the last couple of years. And so at this point, I think that employers want value, and they want a healthier workforce. Employees are tired of what they're getting for their money. And so I think there's going to be a lot of market pressure to provide something that is cost effective, that is quality, that is safe. I think those things are going to get pushed on a lot harder. I'm actually very optimistic about
Mhm.
the future of healthcare because I think that I'm finally starting to see people really get mad about it. And when
Yeah.
people get mad is when change happens. Before, when we first started, even in urgent care, I would go and talk to people about what we were doing. And they didn't really didn't even really understand it. They were like, so, I mean, it's healthcare. You have to pay a little money.
Hmm.
Now people really, they talk about it. It's a thing.
Do you think, and I just kind of thought about this, but do you think that it's easier to measure outcomes and stuff in kind of a controlled value-based care model as opposed to kind of a wide open fee for service? Like, is it easier to track kind of the care journeys and outcomes? And the answer
Well, you
could be
have
no. I
to,
just
right? In
right.
value-based care, you have to.
Okay.
In regular fee-for-service, it's just anything goes, right? But if you
Here's
are
your
getting
medicine. See ya.
paid for
Yeah.
performance or you are getting paid for cost savings, you have to track it. And when you track things, everyone knows that that's the stuff you concentrate on. So
Yeah.
if you're being, evaluated in a value-based care circumstance, if you're being evaluated for generally, by the way, which is kind of nice, is things that you do that make people healthier also save money. So
Yeah.
you can be it's a win-win. So
Yeah.
so I think that yes, 100%. And because technology is so much better, that tracking is becoming easier. Right now, the way that we price our service is just a straight up cap. It's like per employee per month. Because
Right.
to be honest with you, when I started this, we had a really hard time getting data from employers about even what the savings was. It wasn't easy because consultants and brokers sometimes didn't have the data, but oftentimes didn't want to share the data. And carriers wouldn't want to, would make it difficult to get the data. So uh,
Easier in Texas than it is most other places.
well,
To
you know what? That might be
an
true, and it
extent.
was still really hard. So,
Sure.
so I decided, you know what? I'm not going to play that game. I'm not going to be trying to track people down to see if I got paid.
Right.
So we just made it a very low. Our fee for our service is extremely low. It's the average per member per month for a direct primary care in Texas is somewhere between $80 and $120 a member a month.
Hmm.
And we're doing, this, I think, more services for under $75 per
Yeah.
employee per month. So
Yeah.
and generally there's about two people for every one employee. So if you think about that, it's, 30, $40 for per member per month.
And I mean, I know the answer to this question, mainly because it's part of the reason that we're talking. But for employers that are looking to save money on their health plan, like this seems like a pretty easy, pretty no brainer first step. And maybe it's not necessarily a first step for them, but if they're looking around like, where and how can I save money without overhauling the entire thing and making, creating a lot of friction, like presenting a service that people can use if they want to,
Yeah.
that's demonstrated, a positive ROI, like it seems kind of like a no brainer. Like, am
Yeah.
I wrong in thinking that?
No, you're not wrong in thinking that. I will say that I think the biggest holdback for people is that they have to we have to get paid for the services we're providing. So we're getting a monthly payment, right?
Yeah.
And they they have to wait to see the savings, and some of them are just they're nervous. I will say that is a lot less of an issue this year than
Hmm.
again in previous years. The more data, the more years go by where no employer leaves us, the more we, are able to convince people easily that it's worth a try. There's
Yeah.
no harm in trying. What's the worst that can happen is you can sign a year contract. But like I said, I mean, we just don't have anybody leaving. We
Yeah.
have
With
most of our
performance
employers when
guarantees in place, no
they'll
less.
sign a year contract, and then when they come back for renewal, they'll sign a 3 year. So
Mhm.
that's, if that gives you any idea of how they view it.
Yeah. Yeah. So obviously in Texas right now,
Hmm.
but I don't think you're staying there.
No.
What's on the horizon for Next Level Medical?
So this is the most exciting thing for me is that, um, you know, if we want to do real healthcare reform, it can't just be in Texas. It has to be
Right.
everywhere. And um, I am have been racking my brains, had been trying to figure out how do I move this model into other places,
Hmm.
because I truly believe that in hybrid care. I do not believe in a fully virtual model because you cannot do a pap smear, over the
Yeah.
phone, and you
Right.
can't push on someone's belly and see if they
Yeah.
have an appendicitis. There is certain things that, I mean, maybe one day we won't need any of that, but right now, to draw labs, to test for strep, you need a physical location. And that was kind of limiting for me because I thought, well, how can I be everywhere? But I actually had the good fortune of having someone reach out to me. They were from South Carolina, and they said, we've been researching models. We want to start to do an employer direct solution in our state, but uh, so we saw yours. We thought that seemed like you know what you're talking about. And anyway, I didn't want to come to South Carolina to put up my own centers, but
Yeah.
they said, what if we brought the centers to the table and all you did was bring all the back end services that you've
Yeah.
created, your virtual providers, your care navigation, your mental
Yeah.
health, all of those things, the technology. And so we started a program where we white label the app so that those people who want to set up these programs in other states have an easy button. They can do a turnkey because it took us 5 years to develop all this stuff. They
Yeah.
can literally just turn it on. And so we're really excited about coming to Alabama.
Yes.
One of the for early adopters is a client that has many clinics in Alabama. So we're thrilled we almost have that partnership signed. We'll probably be able to announce that in just a few days. So that'll be exciting. And then, we're also talking to centers in California, in Tennessee, in Maryland, in Ohio, so that we've got a lot of different
Love
options of
it.
places where we're going to be. And I think that I'm excited to be able to show the country that there is a better way, that there is a way that is both advantageous to employers and also to employees.
Yeah. Which is the big part, right? Like it's got to speak to both
It's
sides.
got to win for everybody. Yep.
Right. Right. So last question, then we'll get you out of here. Kind of next level medical aside, what are you keeping an eye on for the next, call it 3 to 5 years, kind of within this space? Again, not just with y'all's expansion, but just within healthcare, health insurance in general. What are you kind of keeping an eye out for?
I think there's going to be a lot more direct opportunities for employers with expanded services. So I think that we're going to get paired with, you know, a direct relationship with a particular hospital or a direct relationship with a particular, specialist group or pharmacy
Mhm.
or what have you. I think that people are going to circumvent traditional insurance because it hasn't served us well. So that's what I think. I think Alabama has a particular problem because I think you have a kind of a monopoly of sorts and on insurance. You just really don't have any choices as an employer on who you have as a carrier, and or well, you do have the choices. It's just that everybody's choosing the same one. So what we have to do is bring more choices to the table so that people can, really affect some change and get some savings.
Yeah, I mean, I think that's what I'm hoping for, is that
Yeah.
people understand that you don't have to continue to play that game.
You don't.
Like
Yeah.
there's
It's scary not to though
sure.
when everybody's doing it, you're like, "Oh God, I don't want to be the only one." But once one person figures it out, it'll take off.
I mean, it goes back to the phrase like the most dangerous words in business and the most dangerous words in anything is, well, that's the way that we've always done it. Well,
Exactly.
if we continue to do things the way that we've always done it, then
Yep.
we're going to be in a spot that we don't want to be.
You're going to get what you got. Yep.
Yeah, I mean, what what got us here, will probably continue to get us there if we continue to operate in that mindset. And my hope is that people start to see that you don't have to do that. Like you don't have to go and play in that box. There's ways that you can continue to access amazing healthcare without going through health insurance because they are very different things.
That's right.
And when you can focus on those things, because what I've told groups and I've said it to multiple people, even this week is focusing on health insurance will never impact your health care, but focusing on health care will impact your health insurance. Whether you go the traditional BUCA route or whether you do it in a non-traditional way, you've got to focus on the healthcare part because putting things like advanced primary care or direct primary care or any of those things where you're the care navigation piece, when you're getting people to the right spot and when you're focusing on that part of the journey, not the relationship between a health insurance company and a provider, like that's ultimately what impacts the premium dollars more than anything else.
You hit it on the head.
So my hope is that people start to see some of those things and let's focus on removing the barriers to care and focusing on getting people the care that they need and deserve. And that ultimately is going to have all the downstream effects that we've talked about, several times throughout this is you're going to have a healthier and happier workforce. Hopefully your premiums are going to stay flat and continue to do all those things. And it just, again, it's that waterfall effect. At least
Let's do it. Thank
hey.
you for being, out there preaching the word because I mean, it's like,
Hey,
somebody
people
has
call me
to hear
crazy,
it.
but
You're not, that's great. I really appreciate people like you who can see the opportunity.
well, that's kind of you to say. I appreciate that. And I'm excited to have you in Alabama here next week. I don't know. I think it'll be, yeah. So you'll be here, I think, when the episode drops, which will be nice. So excited
Oh,
to have
great.
you as part of the Cost Curve Summit. But I mean, I, again, really appreciate your time today. I love what you're doing. You're making a significant impact in Texas. And I know as y'all expand, that'll continue to expand throughout the country. So I'm happy about what you're doing, grateful for it, and grateful for your time.
Thank you so much. Have a great day.
Thanks. You too.
Bye.
Bye.